Hello, I'm Matthew Weinstock with a preview of the May issue of Hospitals and Health Networks. You'll see a broad theme developing across the feature articles in this issue. Many of them touch on the ways in which hospitals are collaborating with other providers and organizations in their communities to improve care across the entire continuum. It starts with our cover story, which takes a look at the very complex issue of behavioral health. As contributing writer Jerry Aston reports, 29% of people with medical disorders also have a comorbid mental health condition, and nearly half of all Americans will develop a mental health illness at some point during their lifetime. Many of these patients are showing up at the hospital's front door. Mental illness and substance abuse account for 4% of ED visits annually. Jerry profiles how 4 health systems are working with their communities to provide a more holistic care to these patients. Here she is with more details.
So there have been years and years of public funding cuts to public facilities, public mental health facilities, and the result has been an increase in demand on community hospitals, and especially their ERs, because patients have nowhere else to go. And also, if they don't wind up in the ER, they might wind up in the prison system, and nobody wants that either. One of the organizations I profiled was Montefiore Medical Center, and they're taking the approach of trying to integrate behavioral health professionals into their primary care clinics. And one of the big reasons for that is that people with mental health problems often can't manage their chronic illnesses like diabetes or asthma. And so having the professionals there just makes them part of the team. They work very closely with the primary care physicians. And their team is the primary care physician, the social worker, and a psychiatrist. And they're well on the way to getting those folks integrated into their primary care practices. Another one is in St. Louis, and what happened there was the major public hospital mental health facility closed. So the community health centers and the hospitals got together and created a behavioral health network. And what they do is they've embedded people into the ERs so that if somebody shows up in the ER with a mental health problem, they get connected with the outpatient mental health centers. Same goes for folks who wind up in one of the inpatient behavioral health units at the hospitals. They don't just send them out to the community on their own, they link them up with the mental health centers so that they have a place of care. One commonality I found amongst the different examples was they're trying to really destigmatize mental health care and just make the mental health professionals part of the care team, and that's a big emphasis. For example, at Montefiore, they make it not a big deal. The person's right there in the office. You can just go see them. So the stigma is no longer there, and that happened across all of the examples that I use in the article. I think one thing the hospitals can take away from this story is that it's a good idea to get to know your community and what the community mental health needs are. There are a lot of people out in the community working on these issues already, and you can leverage that and come up with a program that's unique to your community. It doesn't have to be a huge continuum of mental health care. It can be smaller than that, or it could be as big as that if you have the resources. But there's something you can do, and the first step is to start with figuring out what the mental health care needs are in your community.
Thanks, Jerry. Our interview this month is with the CEO and president of H&HN Health, the nation's largest nonprofit health system. In it, he details how the organization is moving away from a provider-centric model in order to take on the increasing demands of population health management. Here's managing editor Bill Santamore with a closer look.
The interview in May is a Q&A with Anthony Tersini, CEO of H&HN Health, based in St. Louis, one of the nation's leading healthcare systems. One thing he talks about is his organization's embrace of person-centered care, as opposed to physician-centered or even patient-centered care. Tersini says it's a path they've been on for some time, as they recognize that healthcare was being redesigned around the individual. That means encouraging people to become more involved in their own care and creating care teams that might consist of clinicians, nutritionists, social workers, or whoever else can help meet the specific needs of an individual. It also takes into consideration the goals of population health management and healthcare's ongoing evolution from an exclusive focus on sick care to promoting health and wellness. As Tersini told our writer Marty Stempniak, we're moving from care that's inaccessible and tied to bricks and mortar to care that's going to be convenient and available 24/7, 365.
Thanks, Bill. And finally, the latest installment of our clinical management series explores how a handful of hospitals are advancing new models of cancer care. For instance, the University of Tennessee Medical Center 3 years ago created a Center of Excellence around cancer care, aiming to provide a comprehensive, coordinated, patient-centric, and multidisciplinary approach that uses evidence-based medicine across the entire episode of care. The organization is making some really good headway on this too. About 70% of cancer patients now receive inpatient care that follows pathways specifically designed around their type of cancer. The articles in this month's issue really offer some strong case studies on how hospitals are addressing some of the biggest and most complicated clinical issues of the day. So be sure to check it out. I'm Matthew Weinstock. Thanks for tuning in.